Hello everyone, I am Dr. Damanjit Kaur, Consultant Psychiatrist, Faith Hospital, Chandigarh. Today, September 10th, is celebrated worldwide as World Suicide Prevention Day. Suicide prevention starts with recognizing the warning signs and acknowledging them very seriously. So I shall be sensitizing you towards suicide and how we can prevent it, in a way that there is a lot of stigma prevailing in the society related to suicide. So I shall be discussing various facts and myths that prevails in the society related to suicide. First common misconception is that people who talk about suicide won't really do it. But the fact is that many people and almost every person who's having suicidal ideations and intend to attempt suicide will talk about it directly or indirectly. So all the signs need to be taken very seriously. Second misconception is that anyone who tries to kill themselves must be crazy, but in fact it is not. Every suicidal patient or every suicidal person is not mentally ill or emotionally weak or emotionally ill. There can be, he or she might be undergoing through grief, misery, frustration, which can lead him or her to take this serious action in his or her life. Third myth that prevails in society is that if someone is determined to kill oneself, nobody can actually help him or her, or nobody can stop him or her to do so. But the fact is that even very severely depressed person does not want to end life. He or she is in a perplexed state of mind of between wanting to die and wanting to live. Actually, they are going through a lot of emotional pain and they actually want to end this pain rather than ending their life. So they do not have any way to stop their pain. So it's just like a cry for help. Then there's another misconception is that people who die by suicide are the people who are actually unwilling to take help. But the fact is that more than 50% of people who dies by suicide seek help within the 6 months prior to their attempt to suicide. Then another important myth or misconception that prevails in the society is that talking about suicide may give someone the idea to do it. But actually, the fact is that it is the opposite. When we talk about suicide to a person who is depressed or a person who shows intent, we can actually make him more comfortable talking about his or her emotions related to suicide, and in that way, when we come to know that the person is having suicidal ideations, we can help and thus saving a life. So take any suicidal risk or behavior as not just a warning sign, but it's a cry for help. So we can, by understanding the ideations, the behavior, the actions of a person, each and every action, behavior and ideations is to be taken seriously. One can save life by understanding all these. Take care, stay safe. Thank you.